My dad, he lived with dementia for several years before he was even officially diagnosed with having dementia. The thing and the challenge that we found was we didn't know where the resources were within our community.
We are a 159 county decentralized state. Within that structure, we have 18 health districts. We've got to meet the differing needs within each of our health districts and meet them where they are to help them when they need it or want it and to support them in their priorities. Georgia's BOLD program is actually known as Be Seen, which is BOLD, Building Our Largest Dementia Infrastructure, using systemic evidence, education, and networks. The work that we're doing here in Georgia happens because of our partnerships. We're really proud of our Georgia Memory Net assisted telehealth program, and that's where those local health departments are able to be the physical location for the diagnostic visits that lead up to a diagnosis of dementia.
Here at the health department, we have very reliable broadband internet service, so we can maintain the bandwidth that's needed to effectively complete a true telehealth visit without some of the hiccups that some of our patients may have at home or at other places in our county.
We're particularly excited about our friends at the UGA Care Center, their ability to reach out into rural communities.
All right, hello everyone. My name is Janae Beer, and I'm from the University of Georgia, and it's a pleasure to be here today. So the Care Center is a hub and spoke model where we get our resources out to the state by working with the various communities throughout rural Georgia.
We invent new technologies to take out and make life better in rural spaces. We publish information on the needs of those rural communities so that everyone else in the state can benefit.
Who has been touched by this disease in one way or another? All right, I want everyone to take a moment and look around. That's almost every single hand.
So in the care center, I see patients and their families, and we do diagnosis of older folks who may be developing memory or other thinking problems to see whether it's kind of normal aging or whether there's a diagnosis of something like mild cognitive impairment or dementia. And it is a free clinic, a free service that we offer. So we get a low-income population that gets referred because they're not going to be able to get services elsewhere.
They want you to know that if you get it or somebody else gets it in your family, that there's resources that our community has, and you can go and you can get those pieces taken care of. So.
Yeah. I love getting out into the community. It's really great just to meet people where they are, bring the resources straight to them, and I think it means a lot to them as well, just to make that person-to-person connection.
All these things are out there and available. We just need to make people aware that they're available.
We have to understand the importance and value of trusted partners at the local level.
I'm happy to connect people to different resources and let people know that you're not in this alone.
Since 2005, the Healthy Brain Initiative has been led by a partnership between the Alzheimer's Association and the Centers for Disease Control and Prevention. Through this partnership, the association and the CDC developed the Healthy Brain Initiative Road Map to guide public health progress. There are 43 BOLD program awards given to state, local, territorial, and tribal public health departments to implement interventions to deliver health at the community level. A public health approach brings the promise of risk reduction, early detection, awareness-building activities, treatment, and care to every community, and there is a significant need to ensure that work continues.